Hey guys, welcome back to another n8n tutorial video for healthcare. In the previous video, we spoke about treatment plans and how to discuss treatment plans with patients, the different options, getting them to provide their consent, do financial counseling, asking them what they need, what they are truly worried about, confirming whether they are coming, having a change of mind, booking their appointments, and sending them appointment reminders. So that was in the previous video. This video, we will be talking about surgery pre and post automation. So yes, the treatment plan has been decided, and there is this need now to do pre checks, pre-visit instructions, as well as post-surgery checks out there. So this workflow here that we have is designed in n8n through various nodes that has triggers, that has filters and logic out there. So I guess to start things off will be, what if every patient scheduled for surgery automatically receives the right message at the right time with zero manual effort from the clinical team? What if a patient reports feeling unwell at 11 p.m. and within just maybe an hour or even half an hour, their doctor is notified, their next of kin is notified, a teleconsult is booked, and a community health visit is scheduled. Not in that sequence, but these are just like the different options out there that this workflow would cater. And lastly, what if your OT scheduling nurse never had to chase a single confirmation call again? So in that sense, your scheduling nurse does not need to go and call patients to tell patients, hey, you remember to come down, remember to report to this venue at what time of the day. They don't have to do it anymore because the conversational AI agent could do all these things on their behalf while they focus on more value-added work. So in a sense, let's get started on this. It's going to be a long one, so let's try and do this in the next 7 minutes. So in that sense, you will see that I guess today there are all these nurses or even what we call them, people who run the admission counters would have to do scheduling by manually calling patients 2 days before their appointment. She goes through that little checklist to check with the patient, hey, have the patient fasted? What venue do they have to report to? Are they feeling well? Has the consign being signed? And is there any change of mind? And on that day itself, somebody calls the OT team and somebody has to go and call the anesthetist and also make sure the equipments are all in, that everybody's scrubbed in, the OT is prepped and everything. And of course, there is this element that this workflow handles as well, which is the post-discharge, that maybe a call on day 7 from the care team would help prevent readmission risk because, after the surgery, there is this brief period of time where I think close monitoring is still required even after discharge. So you will see here, there is a daily schedule trigger right here, where the trigger lane here actually fetches all the surgery cases that's coming through, Airtable, coming through your OT system, anything in the next 7 days, right? So this little lane here, we call this the pre-surgery lane. There are altogether 3 touch points. So there will be a D-7, a D-2, and a D-1. So each of them are basically day 7 days before, 2 days before, and 1 day before. These medical jargons. So each of them sends a little targeted SMS or even a WhatsApp message to the patient in terms of prep instructions. And of course, the message can be customized. Because day 7, you just want to make sure, hey, prepare yourself mentally. And then day 2 is really checking for URTI screening. And of course, day 1 is basically fasting instructions, evening reminders, just to tell them, or maybe even reporting venue, because reporting venue is probably something that you would probably think of the day before. And maybe any comforting message from the care team would help, right? And actually that's all for this little branch right here. And we'll actually have this little check here where we call this the pre-surgery reply. So once all that little messages has been fired out, we actually waiting for the patient to reply. So if they replied yes, they're coming, they replied, so they reply yes, they're coming, we'll inform the OT team we'll inform everybody in the OT team, including the scrub nurse and everybody. And of course, if the patient has URTI now, we could potentially say let's not prep for anything, but wait for maybe the wait list to do replacement. And we will check the wait list report to make sure no one is actually waiting, and we could slot a patient in immediately. And if we could find someone to slot them in immediately, then the replacement found, we could actually notify the surgeon or the OT nurse or whoever to say, hey, there's someone on the wait list. Do you want to fill up the slot? And of course, if the replacement cannot be found, the whole entire OT doesn't need to be prepped. That the team can maybe do one less case, I guess. And there's, of course, there is the no reply one. So if the no reply one takes place, then that's where there is this escalation flow to the care team to say tier 1 goes to scheduling nurse, and then maybe the second tier will go to clinical lead to follow up with the patient. I think following up the patient is important than just blindly prepping the OT out and wasting it altogether if the patient didn't show, right? So then that's where the surgery is done. And once the surgery is done, we go into the next section called the post-op patient reply. So after the patient is discharged home, we have a video on post-discharge follow-up. This is the post-op workflow where it has a little bit more intricacies. So first we'll follow up with a day 2 check-in message, post-op related. Very specific is post-op. And we'll flag to say, hey, are you unwell? Are you okay? And in a way, ask the patient, do you need any other support? Right. And of course, if the patient doesn't really need any other support, then all good, right? If not, that's why there's this thing called an all good little chain down here. And if the patient is truly unwell, we'll notify the NOK that the patient is still unwell. Here we also start to log a few things about readmission risk. So here we kind of start to log that this could be a high potential readmission, and we will notify the doctor immediately that this patient is still feeling unwell post day 2. Just be aware. We also encourage patients to also upload their daily wound care, especially wound care patients, to upload their photo check, right? And they upload their photo so that we can check. And this actually allows this thing called incremental wound checking involved right down here. And you can kind of like see the progress and flag out if it's a high risk or not to the care team. Right, and after 7 days is complete, what we have here is a certain audit trail or even a satisfaction score survey to make sure, hey, everything is done right. And then let's do that little satisfaction survey. We will have another workflow in the next video about capturing feedback from patients. Of course, there are other things about this. Is more like if the patient needed help. So this is where the patient says, I do need a little bit more support in terms of like I'm feeling unwell. This actually activates into the Teleconsult workflow, activates into the house visit as well as medication resupply. And we will schedule a Teleconsult within the next 24 hours. If not, have a home visit based on community health posts nearby. If there's a need for medication resup, we will go through the medication resupply, get approval from the doctor to resupply or the pharmacist to resupply, and go through the whole process to the point of payment and delivery. So yeah, this is all in all the whole flow for surgery pre and post follow-up, starting from the point where we check the different messages across the board for day 7, day -7, day -2, and day -1 before surgery. We also check for URTI screening, evening reminders on where to report. We send notifications to care team to tell them that the surgery is confirmed. We have a replacement check if the patient has URTI. We'll immediately check the wait list to make sure that there's a replacement that can be found. In the worst case scenario, we won't prep the OT at all to save resources. Post-discharge is very key, where we look at wound care, monitoring of the pictures. We will send them a D+2 message to make sure if they are unwell, how best we can work with them to increase their recovery process, where one of which is also to inform NOK that the patient is unwell so that the NOK can also keep a lookout. There is also a check for readmission and readmission risk, and there's in terms of high risk. There are also options given to patients to make sure that they have necessary assistance in terms of teleconsult, home visit, and sufficient medication supply. So yes, this is the overall whole flow of the surgery pre and post follow-up. My name is Dexter, and feel free to comment in the comment section below in terms of suggestions or feedback on this overall workflow. And of course, if you like this video, remember to like, subscribe, and share the video, and I'll see you in the next one. Bye!